UroPatient. Tune in and see. Prepare your health for you and me. Knowledge is power. We make it clear every Saturday morning.
Hey, good morning, everyone, and welcome to the UroPatient podcast. I'm your host, Vic Senese. Welcome to the show. Hey, be sure to do me a favor and like and subscribe. It helps the channel's ratings, and I don't know, I guess that's a good thing, right? We're glad to be here anyway. Hey, today we got a great show for you. We're going to be talking about, especially for those patients out there that wear a catheter, long-term wearing of a catheter, there's a big issue that you can possibly run into, and that's stone formation around the catheter. When it happens, it can really be a big problem. So I thought I'd do an episode just based on that, just to kind of talk about what you can do to prevent it from happening and, you know, why it happens, things like that. So, well, let's get right in. Hey, today we're going to talk about bladder stones and catheters, and they kind of go together, as you can kind of see from this picture. The catheter can be the cause of the bladder stones. So today we're going to talk about all you need to know in the very patient-friendly, no medical degree required way. By the end, you'll know what's true, what's not, and what you can actually do to protect yourself. So if you or a beloved one uses a catheter, this topic really matters because bladder stones can cause pain, infections, and trips to the emergency room. But many cases are completely preventable with the right habits. If you understand why they form, you can understand how to prevent them. So think of bladder stones like rocks that form when minerals in the urine stick together. They don't appear overnight, they build up over time. Now you can kind of see that arrow I've got pointing over there to a couple of stones on an x-ray, and those are what they look like in the bladder. So it happens. Now, a bladder stone can block a catheter when it moves into the catheter opening inside the bladder, acting like a cork in a bottle. When this happens, urine can't drain properly, which may cause the bladder to feel full or painful spasm. You might even notice a little bit of urine leaking around it, no urine in the bag. Sometimes the urine can get cloudy, foul smelling, because a lot of times these are associated with infections. It's not something to ignore because continued blockage can lead to infection or bladder injury. If your catheter suddenly stops draining or keeps clogging, you better get in touch with your healthcare provider promptly, as stones may need to be removed to restore drainage. Now, I'm going to go over here and kind of point. This is our catheter, and you can kind of see that stone formation around the eyelet. That's where the drains right there. It can form anywhere around the catheter. You know, I always say it's kind of like if you ever did the experiments with the string in sugar water, you know, the make rock candy. The string is what we call a nidus of attachment. So just like the catheter, it gives crystals a place to attach. That's what they do. Now, common symptoms. Some people feel pain, some may not. Often this first sign that a catheter is blocking, though, could be pain. That could be a big red flag. Common symptoms include little or no urine draining into the bag, repeated catheter blockage, urine leaking around the catheter instead of flowing through it, and again, urine may be cloudy, foul smelling, or even bloody. And some people feel lower abdominal pressure, bladder spasms, or discomfort, or a constant urge like they gotta go. These first warning signs may show a need to check with your healthcare provider and should never be ignored. Now, fact or myth? This is a big myth. Only people with kidney stones get bladder stones. Not at all. Many patients with bladder stones have never had a kidney stone at all. The catheter itself, as we talked about with that nidus of something for a crystal to form around, like the string in the rock candy, it's the catheter that plays the huge role. One of the big things you can do is get rid of your catheter. Now, I understand you can't urinate and you may have a catheter in for that, but we talked about intermittent self-catheterization a lot on this show. That's always the best way to get rid of a catheter. But anyway, let's keep talking. So another myth, drinking less will prevent leakage. You know, you think if you drink more water, it's going to leak more. Bad news, because dehydration is the worst thing. I hear this all the time. Patients believe that they're drinking less water, it won't leak, but it can actually cause the catheter to block from stones. Because when you don't drink enough fluid, your urine becomes more concentrated, thicker, and more irritating to the bladder, which also encourages that mineral buildup and stone formation. So concentrated urine makes mucus and debris stick together more easily, increasing the chance that the catheter will block and urine will leak around it. Staying well hydrated keeps the urine diluted and flowing, reducing crystals and stone formation, and lowers your risk of a catheter blockage. So don't think you should decrease your fluids. Plenty of fluids, best thing you can do. Now, what kind of hydration should you have? Well, good old water. Plain old water is your best defense. If your urine looks dark, your bladder might be under stress. Drink more water. And you want to we always say that the best thing is to try to keep the urine just a pale yellow. So if it's really dark yellow, it's getting concentrated. And spread your drinking throughout the day so it's, the bladder's constantly making enough urine. Now, here's the big thing. Simple habits can make a big difference. A kink tube can cause urine to back up and form crystals. Now, what are these crystals? We kind of showed them on the outside, but a lot of them are forming on the inside, as I can kind of show in this picture here. See these things here inside. This is a cut open catheter. I cut the catheter open on a patient who had a blocked catheter. So the eyelet's right there. The balloon is this other thing around there. It's already deflated, but look at all that crystal formation inside there. Those crystals are what's going to cause issues with blocking a catheter. And if they start forming, usually if you have it once, you're going to always have them. Now, what can cause that? Well, if you're waiting too long between your catheter changes is kind of like skipping oil changes in your car, and eventually can cause damage. So you want to make sure you're getting your catheter changed on a regular basis. Now, we'll talk a little bit about how often you should get it changed, and you always want to keep your catheter below your waist for better drainage. But whoops, always pointing the wrong direction. Don't do like this guy and let it hang outside the car. So sort of like an oil change, the ideal catheter change schedule helps prevent blockage, infection, and bladder stone formation. Now, for most long-term indwelling catheter users, changing the catheter every 4 to 6 weeks is common, but the best schedule is individualized based on how often blockage, infections, or heavy sediments occur. One of the things that I've done a lot throughout my career is change catheters. And one of the best things that I can do is, because I know my patients, is I start to delay catheter changes if they're not having issues. Sometimes changing a catheter more often isn't the best thing. And I've gone with some patients for up to a couple months between catheter changes. If you look and you read the literature, most of the 4 to 6 week changes were based on dogma, not tested studies. Now we're seeing that waiting can actually be better. But if you're having issues where your catheter is blocking off, that's a different story. Those type of patients I may bring in more often because I don't want it blocking. There's other things you can do to prevent these blockages, and we're going to get into that. So there are different types of catheter. Did you know that? Maybe you didn't. Most of common one is what we see way over there on the left side. That's the latex catheter, and that's what you'll see in most people using. Typically, it's the softest catheter, pretty much the one that's a go-to, but it's not the best catheter for long-term use, because in about 7 days, it can start getting some issues. Now, there's ones that they put something called a hydrogel coating. That's the next one over. And it's a coating that's put over the catheter, makes it more slippery, and that can improve how long it can stay in without having issues. But the best ones, the ones that I like if people are having issues with stone formation, is to go to silicone. Silicone, yeah, that clear catheter. Silicone catheters are less likely to cause irritation and have a wider lumen. So that means even the same outside diameter catheter, when it's made out of silicone, has a bigger inside diameter. It's just part of the process of making them. The latex takes up more room. So those are my go-to. You'll get better. If you're having issues, talk to your doctor about switching to a silicone. They also make these antimicrobial ones, antibacterial ones called silver ions catheters. They're coated with silver. We tried them. Sometimes it helps. most of the time it doesn't, but the silicon's been a big help for me. So why does this even happen? So what's the deal here? Well, it all has to do with infections and the normal biome. You can't get away from bacteria. You know, everybody thinks that a catheter goes in sterile and stays sterile. It doesn't. In about 2 weeks, it's got some kind of bacteria that's climbed up. Once you leave an opening for bacteria to get in, it will. So, and bacteria can attach to almost any type of surface. Once attached, they begin to multiply. And there's the key. They encase the colonies with a slimy matrix that absorbs nutrients and facilitates the diffusion throughout the entire colony. As the colony grows, that in mind, you're going to get these biofilms forming, and these will form on the inside too, like I showed. So what are things you can do to prevent it? There's good news. Bladder stones are treatable, especially when caught early. Things that we can look at is changing the type of catheter. Like I said, switching over to that silicone. Flushing catheters, not a big fan of that. By squirting water into it, I think you're just not going to get anything with that. More fluids, definitely. We're going to talk a little bit about this acidification of your urine, chelating agents, things like cranberries and antibiotics. So, easiest thing, cranberries, they've been studied for their possible role in preventing urinary tract infections in people who use catheters. They contain natural compounds called polyanthocianids, or PACs, which make it harder for bacteria, especially E. coli, the most common one, to stick to the bladder wall or catheter. By keeping bacteria from sticking, cranberries may help lower the chance of developing an infection. While they're not a cure, including cranberry products as part of a healthy routine may provide some extra protection against UTIs. I think it's part of it too is just the increased fluid that you get from using them. Now, this is another thing that we found. There's many recommendations that using citrate, because it can help to decrease the binding for the formation of these stones. The citrate helps. It's a stone blocker is what it is. So the one problem yet with citrate is you have to be careful how you get it. Now, these are some common agents that I listed here, like grapefruit juice, lemon juice. Putting lemons in your water is the best thing you can do, because sometimes if you buy things that have citrate, like, you know, maybe you get some lemon juice, but it's got calcium in it. Calcium, you don't want it. That's a building block for stones. So you have to be very careful about what type of citrate you use. But these things can help, and that's why I listed them there. Now, here's something that's really not always thought of, but you know, the way your bladder normally works, it fills up and then it empties out. A big gush of urine comes out. There are devices called catheter plugs and catheter valves, like you see in these pictures here. Now, these are perfect for simulating what happens with a normal bladder. Normally, your bladder should fill up and then it should empty. That flushing of the bladder with a large amount of fluid, rather than just constantly dripping out, does help to wash away a lot of these stone products. So I've had a lot of good success with that. And, you know, the other nice thing is you don't have to walk around with a bag. Talk to your doctor and see if that's something they think you might be a good candidate for. I've found great success with using these catheter plugs and these catheter valves, like you see here in those pictures. Now, don't worry if you're ever when they call your provider, if you think, I don't want to bug them, maybe it's, if you're having issues, early action is going to prevent an emergency. The last thing you want to do is wait till you're blocked off for 6 hours. And now you're really in trouble, because now you're trying to get to an emergency room. And if there's one thing about emergency rooms, they're not fast. They take, people in with what their symptoms are. A blocked catheter doesn't beat out a heart attack. So you're going to sit for a while. We always recommend to our patients, if we're there, call us and we'll have you come into the office. We can change a catheter the quickest that way. So keep that in mind. Fast action is your best bet. So if you think your catheter's not working, check with your healthcare provider. See what they say. Hey, just keep coming back. check with us here at UroPatient.com, and we'll talk about more great ideas for you in the future. All right. Hopefully that was helpful. Especially if you have a catheter. Saw a lot of nice comments coming through while I was watching my presentation. One of the things I thought about too was the fact that I mentioned a lot of different products, but maybe you don't know where to get them. So I'm going to make life a little easier for you. Let me bring up this picture here. So this is our website. If you go to UroPatient.com, you'll see our website. And on the top of the website now, I put a link to some of these products. I had talked about those plugs on this particular one that you can put into your catheter. So you can click on that. It'll bring you over there. There's some leg bags, and there was a product I talked about called Quick Change. And these are all available through Amazon. The nice thing is if you want, and you go ahead and you click on it, you can go ahead and click on it, and you're going to actually use what I've set up was an affiliate link. So supposedly you'll get a little something to help support the show. So cheap way to support the show and an easy way for you to find the products that you need and want. And the other thing I didn't mention, but just to kind of head, if you notice on the big sign there, is it possible? That's next week's show. I'm going to be talking about circumcision reversal. Yeah, you heard that right. Maybe you had a circumcision and you wish you never did. I'll talk a little bit about what the reality of that is next week. So be sure to join us next week for more of that information. As always, this is the best place to go if you're a patient with urology issues. Come to UroPatient.com. We always have all the great information for you. And now we're going to throw some links into our website. Anytime we introduce some good products that might be helpful for you, good place to find those. So, hey, see you next week for more information on UroPatient.
From research updates to daily advice, Vic explains it all simple and precise. No question too small, no topic too wide. We're your urology partner, right by your side. UroPatient, tune in and see, baby, your health for you and me. Knowledge is power, power. We make it clear every Saturday morning. The podcast is here.